Acute myeloid leukemia, AML, is a type of blood cancer that starts in the bone marrow. It is characterized by the rapid growth of abnormal white blood cells that crowd out healthy blood cells. This can lead to a number of serious health problems, including infections. AML can make it difficult for the body to fight off infections. This is because the abnormal white blood cells are not able to function properly. Anemia. AML can also lead to anemia, which is a condition in which the body does not have enough healthy red blood cells. This can cause fatigue, shortness of breath, and pale skin. Bleeding. AML can also cause easy bleeding and bruising. This is because the abnormal white blood cells can interfere with the body's ability to form blood clots. Symptoms of AML: fatigue, fever, weight loss, loss of appetite, easy bruising or bleeding, frequent infections, shortness of breath, pale skin, swollen lymph nodes, bone pain. Causes of AML. The exact cause of AML is unknown, but a number of factors can increase the risk of developing the disease, including age. AML is most common in adults over the age of 60. Smoking. Smoking is a major risk factor for AML. Exposure to certain chemicals. Exposure to certain chemicals, such as benzene and formaldehyde, can increase the risk of AML. Previous cancer treatment. People who have been treated for other types of cancer, such as lymphoma or Hodgkin disease, are at an increased risk of developing AML. Genetic disorders. Some genetic disorders, such as Down syndrome, can increase the risk of AML. Treatments for AML. The treatment for AML depends on a number of factors, including the patient's age, overall health, and the specific type of AML. Common treatments for AML include chemotherapy. Chemotherapy is the most common treatment for AML. It uses powerful drugs to kill cancer cells. Stem cell transplant. A stem cell transplant is a procedure in which healthy stem cells are transplanted into the patient's body. These stem cells can help to rebuild the bone marrow and produce healthy blood cells. Targeted therapy. Targeted therapy is a type of cancer treatment that attacks specific vulnerabilities in cancer cells. There are a few targeted therapies that are approved for the treatment of AML. Illnesses and conditions associated with AML. Disseminated intravascular coagulation, DIC. DIC is a serious condition that can occur in people with AML. It causes abnormal blood clotting, which can lead to bleeding or blood clots in the organs. Tumor lysis syndrome, TLS. TLS is a condition that can occur when a large number of cancer cells are killed quickly. It can cause a number of serious problems, including kidney failure, heart failure, and seizures. Infections. People with AML are at an increased risk of developing infections due to their weakened immune system. It is important to note that this is not an exhaustive list of illnesses and conditions that can be associated with AML. If you have any concerns about AML, please see a doctor.